You're listening to Life with Herpes, and this is episode 10. Life with Herpes. I am Alexandra Harbushka. I am your host of the podcast, and I'm excited for today's episode. It is with Dr. Brandy McGill, and she is such a wealth of knowledge when it comes to medicine and our bodies, and she's what's called a naturopath doctor, which means that they go about healing you naturally opposed to giving you a prescription for whatever it is you have. So for example, speaking more or less about herpes, she would say, all right, let's try and fix your immune system so that we can prevent outbreaks. That's just kind of an example of what a naturopath does, in case you're wondering. Dr. Brandy's going to go into the interview, but I just wanted to make sure that was clear before we talked about it. So before I cue it over, I want to make sure you are a part of the Life with Herpes Facebook group. It is awesome. Head on over to lifewithherpes.com and you can click there on the button. It'll tell you how to join the group. It is secret. It is uber duper super nth degree secret, as secretive as it can be on Facebook, so that it can protect you and the other people in the group, so that your friend of a friend of a friend, whose cousin, whose friend, who so-and-so you met at a 6th grade dance, does not know that you have herpes. All right, let me cue it on over. Hi, you guys. I'm Alexandra Harbushka, host of the podcast Life with Herpes, and I'm really excited to bring you our featured guest. She's a licensed naturopath doctor in the state of California, and she believes in treating the whole person to help eliminate the patient's concern and restore health and balance. She uses holistic natural therapies that are tailored to each individual to achieve maximum health for women, children, and men with acute or chronic ailments. Her treatment plans may involve a combination of therapies including clinical nutrition, vitamins and minerals, botanicals, homeopath, mind, body, and medicine. She currently is in private practice at Medical Age Management, specializing in women's health, hormone balancing, thyroid disorders, herpes, and digestion issues here in San Diego. So I bring to you Dr. Brandy McGill. Welcome, Brandy.
Hi, thank you for having me.
Thanks so much for being here, Dr. Brandy. So I'm really excited to talk to you about herpes. And I'm sure most of your clients or patients are not as excited to talk to you about herpes as I am.
No, they're not as excited. No, not as much as you.
Okay, well, can you kind of explain, we have HSV1 and HSV2.
Yeah.
Can you kind of explain what they are, what the difference is, how that?
So it's really oral herpes is the HPV1, and so that's the fever blisters or the fever blisters or cold sores that people get, and then there's the genital herpes, which is in the genitals. So that's herpes simplex 2. So that's the main difference between the two. And so it's a chronic recurrent viral infection that people can get, and it's usually transmitted, from person to person to the skin and mucous membrane. So that's simple, simply, but
yeah. Okay, perfect. So if you have HSV1, which is the oral,
yep.
Can you perform oral sex and give that to someone in their genitals?
Yes. And so they now think that herpes 1 and 2 are interchangeably produce oral and genital. So they can be, you can have one and the other one not be seen, or so you have genital herpes, but you don't get the symptoms really of the oral herpes 2. I'm not really explaining this very well, so let me take a step back. But yeah. So you can have the oral herpes can give genital herpes. Just answer
So you can interchange them.
simply that. Yeah, you can interchange.
Okay. And so, yeah, so vice versa, you can
Yeah.
have genital herpes and end up with it on your mouth.
Most commonly, it's like genital herpes given if you have sexual intercourse, and oral herpes if you like kiss someone or drink after someone who has an active. It doesn't even have to be active. You can give herpes anytime, as long as if it's there, you can still give it to them. If you don't have like the big blisters or something, it can still be there, and it can be transmitted to person, but most of the time it's the vesicles that are contagious or transmittable.
And the vesicles, those are the blisters, basically?
Those are the blisters, basically, yeah.
Okay. And to describe it also, the symptoms are the same for both oral and genital, right? I mean, it's the tingly, it's the maybe the swollenness, maybe, I know for myself, my lymph nodes usually get a little not tired, but they get swollen. Yeah. I'm tired.
You're tired with flu-like symptoms, basically. And then the pain is most common, the presentation, or people feel. Some people still have like the itchiness and burning too. And that's usually when it starts crusting over. And then some people, for genital herpes, they have pain during urination too. So those are the symptoms that most come up. Yeah.
And would that be because of the location of the blister, or is that just the entire genital region is just, it's like on overdrive?
Kind of both. If you have that blister there, it's going to cause inflammation. It's going to cause some pain. And then if you think about too, your body's inflamed in that area too. So
yeah,
it's kind of both to your answer that question.
It's busy down there. There's a lot going on.
It's busy.
It's busy.
It's really healing itself, and like it's very uncommon to see. It's mainly in men, probably, for the pain and urination. So
interesting. So and also, from my understanding as well, and I wanted to ask you, it's not just so for genital herpes, it can kind of move. It's not just in the genitals. I always thought, until I have it, and then I obviously could know from my own body, but I always thought it was going to be, right in the genital areas of the vagina or the penis, or that. But it could be on your thighs, right? Yep. It can be your lower abdomen. I'm trying to say that right. It can be in other areas, right?
Yeah. Yes, it can be in other areas. There's also the herpes can go in your eye, which seems horrible. But if you think about like when you had the chicken pox when you were little, and you had like maybe some people only get like one little chicken pox. And then, but it's systematically in your body. So you can kind of think of it that way too. Okay. It's like, it can be in other places.
It can be other places. Interesting. And does it pop up where you, does it pop up where you got it? Like so it's skin to skin. So if, let's say you got it we'll get graphical. And since I'm a female, let's say it's on the left labia that I contracted herpes. Will I always continue to get herpes on the left labia, or can I get it anywhere in my body?
You can get it, it can spread like to the right side of your labella, and then it can spread up to the vagina. It just depends on where the vesicles the mucous membrane pretty much is exposed to. Yeah.
Interesting. Wow.
Yeah.
So we want to keep the area, dry and clean and.
Yeah.
So what are some methods that you recommend when you talk to patients when they say I have herpes or I have an outbreak? How do you, what are like the housekeeping items?
Housekeeping items. So, because like I'm a naturopathic doctor, I try to get to like the root of why they keep getting the recurrent infections. And usually that's it's not a curable disease. It's more a keep the immune system up so it can help fight it and keep it down, basically the herpes. So my main thing is focus on the immune system. So I'm going to give you extra immune support, change the diet by taking out sugar, and then maybe even have you concentrate more on a vegetarian diet, and then adding some supplements that help the immune system for one, but then also help fight the virus too. Like certain nutrients are there to fight the herpes virus in general.
Yeah. Okay. So yeah, that was going to be my next question. I guess is what causes the outbreak? So you get it. It's like chickenpox. You get it once, right?
Mm-hmm.
And you don't get chickenpox again. It just, the virus just lives in your body and it goes away, and then it could pop up as a shingle. So you're talking about boosting your immune system. So the herpes virus and the outbreaks is what we commonly know. What causes these things? Is it poor immune system? Is it environment? Is it, how does that work?
Yes to all of those.
Okay.
So it can be your immune system. You just like get a cold, you have an outbreak. So your immune system is down. Then you can get it. Some people, for like cold sores, you can get it from just being exposed to sunlight.
Really?
Sunlight can cause the cold sores to come out. Stress can cause it huge because it decreases the immune system. So anything that puts like stress on the immune system can cause you to have an outbreak. So emotional stress, physical stress, trauma to like your body, any illness can cause an outbreak.
So when we have, because we hear stress, like let's say there's a death in the family, right? That would be a stressful thing, right? A death in the family would cause stress.
Yeah.
What if there's so much excitement? Like what if you gave birth, like, or you just found out you're pregnant, or like there's just pure joy? Does that cause the same stress on your body that, say, a sadness would cause?
That wouldn't cause the same stress, so I wouldn't expect to have an outbreak then. But I mean, too much happiness, I don't think is a bad thing.
So keep happiness and keep laughing, and keep smiling.
But pregnancy can just, in general, can cause an outbreak. So because it can put stress on the body, your body's having to deal with, and it's a human being growing in you. So there's extra stresses that the baby needs more of your nutrients too. So you're just going to need to add and be more preventative and protection. Increase the immune system.
Increasing. So it basically boils down to keeping a healthy immune system.
Yeah, pretty much. Yeah.
Does herpes, like what comes first, chicken or the egg? Is it the herpes virus gives you a weakened immune system, or do you get a weakened immune system and then you get herpes? Or is it kind of one and the same? Like I said, chicken or the egg, which came first? They both work together with a weak immune system.
Well, usually, I mean, if you're exposed to the herpes virus and you have a weak immune system, you're gonna get it. Mm-hmm. Even if you're exposed to it and you don't have a weak immune system, you're still most likely gonna get it. But for the reoccurrence of it and how often you're gonna reoccurrence, keeping that immune system up is gonna help you not get it as much, or feel the symptoms of it.
Feel the symptoms. And do you get it more when you first contract the virus? So when you find out you have herpes, do you get outbreaks more often than, say, if you've lived with it for 10 years, 20 years, 30 years?
I think it depends on the person, like where they're at, and if they, most of the reoccurrences do happen at the beginning of when you get it. So the first year you might have more than the next year. So, but it also can be, if you have a stronger immune system, you get it that one time, the first time, you might not get it another time. It just depends on a person.
Mm-hmm. And you can pass it without having an outbreak, correct?
You can pass it. That's why they recommend always, if you have genital herpes, to always wear a condom.
Mm-hmm.
Yeah.
But what if you don't have the outbreak in the area that a condom would cover?
So the thing is that like, if you are not in tune with your body and you don't know that you're getting the outbreak, and you might be already in that stage of like getting it, you just don't realize it yet, then you risk the chance of spreading it then. But so that's why they still always recommend wearing a condom, even if you're not in the middle of an outbreak.
I mean, yeah, that's important. And then,
Yeah.
I mean, obviously you want to do what you can to prevent your partner
Yeah.
from getting herpes. I mean, there's, I guess the way I look at it is it's just a skin disease, right? When you boil it down, it's a skin disease that has a stigma attached to it. But at the end of the day, it's not something you want. You don't want to like sign up for it and be like, oh, it's not like when I was little, or I'm sure when you were little, before we had the chickenpox vaccine, that parents would take their kids to be like, oh, your kid has chickenpox. Great. I want my kid to get it so that they have it. It's not, herpes is not like that. It's like, oh, you have it. Let me kiss you. So I get it too. So we're good.
Yeah. No, like, just like, it's like one of those things. It does have a stigma that like people that people don't want to have it, but you still need to be respectful to your partners and tell them that you have it, and then just kind of take measures to prevent them from getting it.
Yeah. So what are some impacts you have on your life when living with herpes? Like are there, like I just said, it's basically a skin disease. And I've heard people say, I've talked to some friends that have it, and they go, you know what? I actually am really grateful I have herpes, because that means I know that I need to take care of myself. As soon as I feel a tingle or a sparkle or whatever they want to call it, I know that, wow, I need to stop what I'm doing. I need to take a nap. I need to go for a walk. I need to basically cancel my plans I had for dinner tonight and go home and go to bed. Whereas if, this is one particular friend that said that, she goes, whereas if I didn't have herpes, I would have kept going. I would work my 12-hour day. I would go out and do the dinner thing and go, do the cocktails, and then go home and crash, and then wake up the next morning at 6:00 and go to my yoga class, and then be at the office at 7:30, and then just continue on that busy lifestyle. So, I mean, what are there any life implications or impacts that show up in your life that go, oh, you have herpes, you can't do this?
There's nothing that like, there's things like, I think for most people, the oral herpes are the worst, because it's like people see it and like they know, oh, you have, like people can just see that. And so more people are more subconscious about it. So, I mean, I know someone who can't get in the sun without getting an outbreak more, so we have to like really boost those immune systems. So that can be a non-benefit of having herpes. Right. But then other that, just like, I mean, safe sex should be practiced anyways. So, I mean, should that like really hold you back anyways? It's just, I think the main thing is just always letting the person know, the partners know, and stuff like
the due diligence of letting them know. Now, I've also read that, which I find this impossible to know, because when I have both, I have HSV1 and HSV2, and when I got the oral herpes, I had to go to the hospital. I was so sick. Like I physically my fever was so high. I was 20 years old, and I had to go to the hospital. Right now, I knew I had something. Like this wasn't like I didn't like miss it. Right?
Yeah.
And then same when I got genital herpes, I was so sick. Again, I didn't go to the hospital, but I mean, my genital my vagina was so swollen that I couldn't even sit down. Like a thong hurt, and to sit down and cross my legs hurt. And I knew something was wrong. Right. So how is it that people don't know they even have it?
So
do they just not show signs? Or are they just in denial of what the signs are? I mean, again, I was in so much pain. There's no way I could not notice it.
Yeah. So I guess some people just show symptoms, or they ignore symptoms maybe, that they have it and they just don't tell it. Some people just, I would say most people, it's a hard question to answer. Basically you're asking if some people just don't show symptoms, so they don't know it. So there's like, some say that like, I don't know, they just probably just ignore the symptoms more likely, or they
weren't as severe as mine.
Yeah, they weren't as severe as yours, and so they don't like. Some people, even though they get like the flu, they keep working. Like,
right.
You feel like your body gets down and they just keep going. But so they just basically ignore the symptoms of it, basically.
Interesting.
Yeah.
And probably, and I think too, with STD checks, when you go to your doctor and you say, or you go to Planned Parenthood or wherever it is that you go, and you go for especially when you're in those, I guess, the teenage to like those college years, it's probably, as a physician, you would say like, yeah, it's on your checklist to say, hey, do you need an STD check? Like that's probably one of the biggest things. But I think a lot of times too is because it requires a blood draw, right, to actually test, unless there's a visible sore, a lot of people just don't test for it.
Yeah, it's true, because most of the time it's just diagnosed now just through looking. You're like, okay, I see it, it's there. You can do a swab or the actual vesicles or the blood tests, but most of the time the blood tests aren't done unless there's symptoms.
Right. Or maybe you're exposed to it. You have a partner who...
and the patient requests it because their partner
has it. Interesting. Yeah. I mean, I just don't understand how people don't know they have it. But I mean, I have the oral herpes, and I had an outbreak the very first time. It was so severe. I was in the hospital. I have never had another outbreak on my mouth, and I was 20 years old. So it's been a good 14 years. So I guess, so why is that? Why do some people have outbreaks and some people don't? What does it have to do with your immune system, or
it's
how it
your
lies?
Immune system, and it's like how it lies, and just depends on that person. Everyone's different. Like you said, some people will have one outbreak and never have it again the rest of their lives, but some people will have it like once a month or every other month, and mainly it just depends on the patient or the person.
Depends. Yeah, because it's not the same for me in the genital side. It's not like I had one outbreak and I've never had one again. That's the exact opposite. So it's just so interesting to me that basically a virus they're basically cousins, right? The HSV1 and HSV2, or brother sister more like, right? They're so similar.
Yeah, they're similar. Yeah.
And is it common for people to have both, or if you have one, you're pretty much good?
You're pretty much. I wouldn't say it's common to have both. I don't know if I would say common or put it in the common category, but it's a common virus that you see now. Like, I don't know the statistics on how many people actually carry it or anything, but and I don't know if I would say like, well, if you have oral herpes, you're gonna probably get the genital herpes. I wouldn't say that at all. So it just depends, like, on the person, basically. I'm gonna say that a lot.
It depends, right? And so you, as a naturopath doctor, what you kind of said first is you look at the person, you look at their lifestyle, you look at their makeup, and go, okay, well, we also have these issues going on with you, not issues, but you have these concerns that you want to look at as well. And let's look at your diet. Let's look at your sleep. I think for me, and that's something you've helped me with, is sleep is huge. Yeah. Sleep, to me, if I don't get proper sleep, I can feel an outbreak coming on.
Yeah, definitely. So the thing about like when usually someone doesn't come to me and just say, I have herpes, can you help me? They usually have something else going on. And so while I'm treating that, the herpes, of course, I keep in my mind. And so I know I had to kind of increase the immune system. But while I'm healing the body too, they can have more outbreaks of the symptom or the herpes, or as I'm healing the body too, and I'm getting to like the root cause of the issue, the herpes can slowly start decreasing the reoccurrence of it too. So that's why it's important to get to like the root cause of your illnesses, even though you know how you get herpes, but why are you getting your immune system suppressed, and where's the inflammation coming from, basically?
And then how do you keep it lying dormant? Basically, right?
Yeah.
And
Basically, that's my goal. Yeah.
Keep it dormant so it just hangs out in your body and doesn't come up to the surface.
Yeah.
Doesn't get angry.
It doesn't get angry. Yeah, the symptoms, if you think about the symptoms, they are like angry, suppressive. That's how they kind of, if you put them in a category of feelings. Yeah. Angry. Yeah. Like the angry symptoms are coming. Yeah. Like that.
They're showing up. Yeah.
Yeah. Your body's becoming angry at you.
Do you notice, because again, you heal all aspects of the body, do you notice that there's other symptoms going on in the bodies that are kind of a root cause to herpes? Or is it, is it kind of like a puzzle piece when you're like, well, obviously you're getting outbreaks because you have this going on in your body, or you have like your this is your diet, of course, like it does it all work, or is it not that simple?
It can be simple, and then sometimes it cannot be simple. So diet is huge. I mean, if you eat a bad diet, and to prevent a breakout, I would try to get them on a healthier diet, avoid food sensitivities, because that just causes more stress on your body, and then stress causes the immune system to go down. So that can help decrease the immune system. Getting gut health, and it really depends on what the person is going through and what they have. So that can be complicated, but it also can be easy, simple as taking out food sensitivities. So
really,
yeah.
And then what's the difference between, say, taking the Valcyclovir, which is the generic brand of Valtrex? What would be different? What does Valcyclovir do, and what does taking out, let's say, sugar in the diet do? What's the difference here?
So the antiviral is just killing the virus and or preventing the virus from replicating, which is when you start replicating, then you're going to get the symptoms. The sugar is going to help the immune system. So it's going to do the same thing in a sense, but it's just improving overall your body, helping the sugars, decreasing the sugar is just going to help your body heal itself. But the antiviral is just you taking something to actually kill it.
Okay. So, and being on the antiviral so being on the antiviral, it's kind of like a pill that you don't have to worry about it. You can eat whatever you want, more or less, right? You don't have to watch your diet. You don't have to watch your sleep. You don't have to, it's basically like a Band-Aid to say, well, I take a pill and then I'm good to go, and I can not watch my body or listen to my body for cues, opposed to what you recommend is, hey, let's look at what the cues are in your body. Let's heal that. Let's say, hey, your diet is all out of whack here. You're not giving yourself proper nutrition to have a healthy immune system, or you work 20 hours a day. No wonder why your immune system is shot, or whatever it is. So that's kind of the opposite is, and I'm assuming they're both good, right? There's great reasons to use an antiviral, and there's times when your body needs it, and vice versa. There's times when your body needs rest and nutrition. And not to have 3 pieces of birthday cake.
Yeah.
That got me one time. I had 3 pieces of this really good cake. It had sprinkles on it. It was really good.
It's pretty cool. 3? Wow.
I did. It was a
Yeah.
big day. I had 3 pieces, and then that night, and I had a peanut butter sandwich for lunch. And that night I went to bed going, I haven't had an outbreak in 3 years. And here it is.
Yeah. So, sugar can definitely do that. But now you realize like the effects that sugar, you can kind of almost predict like, oh, I pushed it too far.
Oh,
So,
yeah. Now I can. Yeah.
But some people would want to just go ahead and do the antiviral and still get healthy at the same time. So you're preventing it and both. Yeah.
On all levels.
And
does it really just boil down to the patient and the patient's needs and the patient's wants?
Yes.
Okay.
Yeah.
Cool. I'm sure people listening are like, oh, this is interesting. I didn't know. Because you told me about peanuts, saying, hey, peanuts are one of the worst things for outbreaks.
Yeah.
It's miracle grow for them.
Yeah. Yeah. It's surprising what foods can help and grow it, and what foods can't help keep it down or help it not feed it, basically, like you said, like miracle grow.
Yeah, I didn't know.
Yeah.
Okay, Dr. Brandy, so what are some tips you can give the listeners here that are tips when you have an outbreak? What's the quick fix in your cupboard, or something you can just say, okay, I need to do this, this, and this to kind of get over the hump and feel better?
So first is to reduce that stress. So sleep.
Okay.
Getting your 8 hours of sleep, meditating. If you have the oral herpes, you might want to avoid the sun while you're going through the outbreak. And then applying an ice cube can help. How when you twist your ankle, first thing you do is put an ice pack on your ankle. Mm-hmm. So if you put an ice cube on the outbreak, you can keep it there for 60 to 90 seconds. It will help decrease the pain and inflammation, just like it would your ankle, basically. Support the immune system, so you can increase your vitamin C, increase your vegetables, the green, the purple, the orange, and the yellow. All of those contain extra vitamin C and vitamin beta carotenes and vitamin A. So those are going to help your immune system. And then cut out that sugar.
Don't have 3 pieces of cake.
Don't have 3 pieces of cake, especially during an outbreak. Totally delete the sugar.
I know the last time I had an outbreak, my college roommate came to visit me, and I was like, oh, I'm so boring right now. I can't do anything. And she's like, let's have a mimosa. I was like, I can't. And then it's like, oh, well, so I was like, I can't. I was like, I'm so boring. I'm so sorry. But I'm not trying to be the Debbie Downer here, but it really does. I wanted to try it because in the past when I've only had 1 outbreak at this point, not using the antiviral, and I wanted to see how long it would last, or just do my own science experiment in my own body. And when you do cut out the if you do say what Dr. Brandy says, get some sleep, rest, eat really, really nutrient dense foods, cut out the sugar, cut out the processed foods, cut out the alcohol, the mimosas with your college roommate. It really does work. I would say probably maybe 1 extra day with an outbreak opposed to taking the antiviral. But it definitely does work. You have to take care of yourself, which is what you're supposed to do when you have an outbreak. I mean, your body is telling you, hey, slow down. I'm exhausted.
Mm-hmm. Yeah. I mean, it's what everyone's supposed to do, those things too. Occasionally, in general, occasionally you can have that piece of cake.
Mm-hmm.
Because I mean, now you've occasionally, I mean, you've had a piece of cake since.
Yes, of course.
Just don't go overboard.
Of course. It wasn't even my birthday. It was just so good.
It was just so good.
It
Yeah.
was. Okay. Well, thank you so much for sharing this. I mean, actually, how do you handle the emotional side of it? Do people come in devastated? Do they come in shocked? How do you handle the emotional side of it?
So, um, most people come in and they barely even say that they have it. It's either on the intake form that I give them, or they're like, "Oh, I have herpes," and then they just keep talking like really fast. And I'm like, "Oh, wait, okay, like can we
Yeah.
go back to that and like talk about that for a few minutes?" Um, the um, the hardest part is like I just want to make sure that they know how it's spread and that they prevent from spreading it. And um, not the hardest part. Like usually people know it already. It's just good to reiterate it. And um, I think the hardest part is more the females, because sometimes the guy might not want to wear a condom, and so they feel like obligated, not to do it or something. So that emotional stress is hard to deal with, because it's up to them what to do. It's like
Mm-hmm.
they have, but I have to. They need to prevent it from spreading, basically. And um, there's not too much emotional. Like I haven't had to tell anyone that they've had it yet, but the good news is that the awareness is getting out there, and with the help of this podcast, it's going to get there out there more. And so people, the important part is just the transmission of it, and just making sure that they're taking precautions of it. So
Right. Well, good. Yeah, good. That's interesting to know that, yeah, the women handle, I think the burden, I think it, I think it goes back to the fact that it's okay for a man to sleep around, but it's not okay for a woman. And you get genital herpes. The stigma is you get it from sleeping around, which is not the case at all. But that is what we have been told, or that's what we've been fed.
yeah,
Or we've been told that as, oh, well, if you sleep around, you're going to get an STD, so you better not. So it's been fed as a cause and effect type of theory to keep people from having sex. And it's usually the women that carry that burden of, you feel like you're a scarlet letter, or you are an old maid, or no one's going to want to sleep with you. So
yeah,
that's interesting that you say, yeah, it definitely shows through when you meet with your clients, your patients, whether it's female or male.
yeah, yeah.
Yeah. Interesting. Okay, Dr. Brandy. Well, thank you so much for sharing your expertise and explaining what naturopath medicine is, and how you treat the overall root. You treat the root cause, opposed to putting a Band-Aid on a symptom, and how you really want to ultimately get the body to a utopia phase and get it working on all cylinders to get the immune system ramped up so it can fight the body. It can fight these viruses, because obviously
Yeah.
we've lived millions, billions of years with the herpes virus, and we're going to continue, I'm sure, to keep living with it as long as the herpes virus is alive. So it's going to stay with it. It's going to it's like humans, but like a dog is man's best friend. Herpes is man's best friend. It just keeps on going with us. Um, so thank you so much for your expertise and being on the show and sharing
Thank you for having me.
You're welcome. Thank you so much. Well, thank you.
Thank you.
Hello, I hope you enjoyed today's episode and interview with Dr. Brandy. I know I always learn a ton from talking with her, and I love having Dr. Brandy on the show, and I love hearing everything she has to say, especially when it comes to herpes. So if you have not downloaded the free ebook on the 9 seldomly used but incredibly powerful over-the-counter herpes remedies, you're going to want to do that. So head on over to lifewithherpes.com, download it. It is free. I reference it, I use it. Even though I wrote it, I sometimes forget about the over-the-counter remedies that I use. There's a lot of them, so 9 of them to be exact. All right, head on over to lifewithherpes.com, fill it out, and have an awesome rest of your day and an awesome rest of your week. See you soon.